Hepatitis. We're going to be talking about hepatitis, everything you need to know about hepatitis, the types of hepatitis, how to treat hepatitis, the causes of hepatitis, and the vaccine, how to prevent hepatitis, and the vaccine for hepatitis, because it's not all types of hepatitis has vaccine, and then the prevention of hepatitis. So you need to listen attentively and don't skip any parts, because you need to know the types of hepatitis in order to know the treatment. Okay, so let's get to it. Now, hepatitis is an infection or inflammation of the tissues of the liver. Okay, it damages the liver cells. Okay, so this is basically an infection or inflammation that damages the liver cells. Now, it is important to note that the liver has lots of function, which I'm going to mention briefly, because if you don't understand the functions of the liver, when hepatitis sets in, these functions of the liver cannot be achieved, and this is what the person encounters. So these are the functions of the liver. The liver detoxifies the blood. Okay, the liver converts excess glucose, stores excess glucose and converts them as glycogen. When there is excess sugar in the body, the liver has a way of processing it, sending it to different parts of the body where it is needed, and then storing it, so that when you don't have energy, that stored glucose can now be converted, and then the liver gives it to your body. You now have energy. Now, the liver also produces what is called bile. This helps in detoxification of fat. Okay, so these are basically, it also helps in digestion. Okay, digestion of protein. So, and also the liver helps store some vitamins and some nutrients. For instance, vitamin A, D, E, and K, the liver stores them. So these are the very many importance of the functions of the liver. I don't want to digress a lot. So we are going to talk about hepatitis. Acute. Okay, hepatitis can be acute and chronic. This is very important that you should note that there is acute hepatitis and there is chronic hepatitis. In case when you are diagnosed, you need to find out what's going on. Okay, now acute hepatitis is hepatitis that just comes and doesn't last, probably within the first 1 month to 3 months, highest 6 months. So acute has a short duration. Okay, 1 month to 6 months maximum. But chronic and acute comes suddenly, but chronic takes time. Chronic lasts over the years. Okay, it lasts over the years, and these ones are the ones that usually is an issue. Okay, however, acute and chronic are issue, but acute is usually resolved. Okay, so it is very important to note that there is acute hepatitis and there is chronic. Acute short period, chronic long period. Okay, so chronic hepatitis can lead to liver failure, liver cancer, liver damage, and liver cirrhosis. Okay, liver cirrhosis means when there is scarring of your liver. It's seen in the cases of alcoholic. Okay, and the later part of this video I'll be explaining to you where the hepatitis that is caused by alcohol, not only the other types that there are hepatitis that is just caused by alcohol, congesting alcohol. That's the later part of this video. Now, we're going to be talking about the types of hepatitis or the classes of hepatitis. Please listen attentively. Hepatitis is classified as or types as hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. These are the 5 types of hepatitis that we have, and I'm going to be explaining each of them, the causes and the prevention of each of them. So let's get to it. But the most common type of hepatitis that people are aware of is hepatitis A, B, and C, but there are other kinds of hepatitis, 5 types. Okay, so and let's get to the causes. Now, causes of hepatitis varies. It could be infectious, it could be non-infectious. Infectious means that it could happen as a result of an infection, probably blood-borne, exposure to, blood, having contact with blood-borne, and some are not like that. Some can be as a result of habits, lifestyle, okay, non-cleanliness. You will get it when I get there. So let's talk about hepatitis A. Okay, hepatitis A is mostly contacted with while ingesting food that are contaminated. Okay, food that are contaminated with hepatitis A. This is usually seen in the cases of eating not well cooked food. Yeah, not well cooked food, food that are not washed properly in the cases of fruit and vegetables, okay, and eating foods like shellfish that are not well, drinking contaminated water, okay, and eating food that are prepared by somebody that has this hepatitis, who did not wash his or her hands properly and just maybe used the toilet, okay, and didn't wash their hands, okay. So this is why you should be very careful and wash your fruits and vegetables, and make sure that the foods you eat are properly cooked, and also try to handle your foods process cooking by yourself. So I didn't mention that hepatitis A is caused by the hepatitis A virus. Now let's get to hepatitis B, which is also one of the common hepatitis. Hepatitis B is caused by the hepatitis B virus, transmitted through bloodborne secretion, vaginal secretion, for instance, during sexual intercourse, unprotected sexual intercourse with somebody that is infected, okay. Vaginal secretions, semen, having in contact with semen that is infected, okay, and also sharing of needles with people that are infected. Somebody use a needle that is infected, you're using the same needle. In cases of giving injection, tattooing, piercing, this is how hepatitis B can be spread or transmitted. It is also transmitted through mother and child. Yeah, mother and child transmission. A mother can transmit it through to her baby when the baby is in the womb or during childbirth. Hepatitis C also has the same transference of hepatitis B. It is also through blood transfusion. It can be getting through blood transfusion. It can be gotten through sharing of the same needle, piercing, tattooing that is infected with blood, okay, and through sexual intercourse too. Now, hepatitis D is what we are going to be discussing. Hepatitis D is caused by the hepatitis D virus, okay, and hepatitis D multiplies in conjunction with hepatitis B. Hepatitis D happens when somebody has hepatitis B that is untreated. So when you have hepatitis B and it's untreated, it multiplies, and then now let's talk about also the non-infectious type of hepatitis, causes of hepatitis, I beg your pardon. Okay, the non-infectious causes of hepatitis is alcohol. Yes, there is what is called liver cirrhosis. It is one of the causes, the effects of the non-infectious hepatitis. In the presence of hepatitis B, there is usually hepatitis E over time, okay, when it is not managed properly. Now, it is also important to note that there is the last type of hepatitis, which is hepatitis E, caused by the hepatitis E virus, okay. This hepatitis E now is one of the non-infectious hepatitis. This is caused by waterborne, it's spread by waterborne, okay. This means drinking water that are not good, that are not clean, okay. Most waters that are not clean has this hepatitis E virus in them, okay. This is also usually seen in places that are overcrowded, places that has poor sanitation, poor hygiene, okay. So it is hepatitis E is basically spreaded through water and through unclean water, okay, and unsanitary environment. Consumption of excessive alcohol not only can causes non-infectious hepatitis, okay. This will damage the liver, leading to liver cirrhosis, where the cells of the liver is scarred, okay, and inflammation occurs. Now, another cause of non-infectious hepatitis is some certain types of medications. Okay, there are some certain medication that can scar the liver. Now there is also autoimmune disease. Autoimmune disease means diseases that happens as a result of the body fighting itself. So when somebody's body begin to see any part of the organs as having issues, or any the part of the body as seeing it as a danger, it starts fighting against it. So people that have autoimmune illness, sometimes they can the body starts seeing the liver that is as a toxic organ, or seeing the liver as a something that is bad for it, or the kidneys, or any part of the body. Okay, so this is basically what autoimmune the treatment of hepatitis. I will tell you how this is tackled. Okay, so autoimmune disease is another non-infectious cause of hepatitis, where the body starts fighting the liver and then start destroying the cells, okay, and all of this. Another cause of non-infectious hepatitis is toxins. Okay, toxins, for instance, asbestos, or painting, inhaling painting, insecticide, injection of drugs that are bad for the kidney, in the sense of drug poisoning, taking excess drugs, for instance, people that want to commit suicide, or taking the amount of drug that is not good for you, or in the case of herbal medications, taking herbal medications that are, or taking drugs in excessively that is not prescribed, injecting it at once. When I was mentioning the functions of the liver, I mentioned that the liver detoxifies drugs. They work on the drug. When you take drug, they detoxify it. Okay, so when you take this in higher quantity, it amounts to toxins and can damage the liver cells. Okay, so we're going to be talking about the symptoms that you may have hepatitis, or the symptoms of hepatitis. Number one, dark stool. Okay, before I mention the symptoms of hepatitis, it's important to know that chronic hepatitis, because of the long duration of time, like I explained, most of the times you might not even know that you have hepatitis. Okay, so you may not know. However, in the acute, okay, these are the symptoms of hepatitis. Number one, fever, okay, because of the presence of an infection going on. Number two, dark stools, okay, because of the bile is no longer being produced by the liver. Like I mentioned to us, that the production of bile, okay, so bile adds to the color of the stool from green when it's produced is green, and then when it digested and all of those things, it gives the stool that brownish kind of color. So the stool will no longer become brown, it will now be black or gray color, because there is no bile. So seeing this, your stool is becoming gray black, it means it's a serious sign of liver failure or liver issue. Dark urine, please, this is very important. I'm going to make a video on the color of your urine, what your urine should be. Green, black, yellow, red, purple. This means so many things in your system. Okay, fatigue, you're tired, of course you will be tired, so always constantly becoming tired is a sign of hepatitis. Then abdominal pain, it could be at your side, like a flank pain, at your back, or serious abdominal pain, please, or abdominal discomfort. This is a sign of hepatitis. Very important, jaundice or yellowing of the eye. The eye is like yellow, this is jaundice. Please, this is a sign of hepatitis. So nausea and vomiting, okay, nausea is always having the feeling that you want to vomit. You're not vomiting, and vomiting means you're throwing up. So serious nausea and vomiting, coupled with all of these signs, are signs of hepatitis. Now, how is hepatitis diagnosed? Hepatitis is diagnosed when you get to the hospital. Of course, the doctor asks you your history, finds out if you've been exposed, okay, with your history, and then with the symptoms you're having, then the doctor sends you to do series of tests, blood tests. Can ask you to do liver function test. This is a blood test finding out the levels of your the function of your liver, okay. what the values are, if they are normal, if they are abnormal. Okay. And the another way your doctor can confirm of this is by liver biopsy, where a little part of your liver tissues can be taken and used to conduct tests. This finds out the kind of infection you're having, the inflammation you're having, right? If the stage, the level of what the infection has gone, or the level of the inflammation, what has happened. Okay, so this helps your doctor find out what is going on, and then the kind of hepatitis that you're having. Okay, so the next one is how to diagnose hepatitis is through abdominal ultrasound. The doctor checks to find out if there is fluid in your abdomen, if there's anything piercing in any organ, maybe cancer or anything, or the inflammation, how bad it has gone, how bad it has affected the liver, or if it has spread to any other part of your body. Okay, or so these are the ways you can find out or hepatitis is diagnosed. Now we're going to get to treatment of hepatitis. Please, in the treatment of hepatitis, if you did not watch the previous videos, because most people come only to treatment, please go back and watch. Even if you have the hepatitis and you're interested in treatment, knowing this hepatitis, the other things, the types of hepatitis, causes, symptoms, and all of the things I mentioned will help you to treat hepatitis. So please don't rush to treatment. Start this video from the beginning again. You can be doing anything while listening to it. Okay, so treatment, the initial treatment of hepatitis usually is resting. Okay, resting, relieving the symptoms, nausea, vomiting, abdominal pain, all those symptoms you're having. Your doctor has a way, gives you things to relieve the symptoms. So it is important to note that hepatitis A, B, and E usually resolves on its own, because if it is on a short trend, if it is on acute trend, not all the time, but most of the time, it resolves on its own. Okay, but chronic hepatitis B, remember what I said is acute. So you know what acute means by now if you watch the meaning. Acute hepatitis A, B, and E usually resolves on its own. Okay, because of the short trend. Okay, but chronic hepatitis B, okay, and acute hepatitis C will be treated with antiviral medications. By now, if you've been following this channel, you should know that antibiotics does not treat viral infection or virus. Okay, there are viral drugs, antiviral drugs. So chronic hepatitis B and hepatitis C is treated with viral drugs. Okay, there is no remedy of going to use herbs or doing anything or taking antibiotics. No, it is treated with antiviral drugs. Okay, it now depends on the stage of which you are and if it was found out early. It's also very important to note that hepatitis C has no cure. Yeah, for now, though the antiviral drugs will really help it, prevent it, help it. Okay, I said not prevent it, it will really help it. Okay, reduce the viral load and further destroying of your kidney, of your livers. Okay, but hepatitis B also with the viral drugs helps with cures hepatitis B. Cures hepatitis B. Okay, like I said, hepatitis B resolves on its own. Acute, most of the times it resolves on its own. Okay, so hepatitis C, also very important to note that you have to be very careful. Okay, in the prevention of hepatitis, please, this is in the prevention of hepatitis C, please make sure you don't share razors or toothbrush, or unsterilized needles, or sharing needles with somebody. Even when giving injection, you're taking injection, make sure the needle is opened right in front of you and the syringe is opened right in front of you. Okay, though hepatitis C is may not really be gotten through unprotected sex, but you should also try to protect yourself if you're having sex with a new partner. Okay, for pregnant women, if you have hepatitis of any type, make sure your health provider knows that you have hepatitis. Okay, so this is all about it in treatment of hepatitis. Now, treatment of alcoholic hepatitis. Okay, well, it all depends on the amount of damage that has been done. If nothing really has been the damage is not so much, the doctors take up where the liver is. Okay, first thing is stopping alcohol, number one. That's the first thing. Resting, drinking lots of water, taking your medication, reducing fatty foods. Okay, because when you take lots of fatty food, it also stresses your liver, because your liver has to deaminate this fat. Okay, so in the cases of autoimmune hepatitis, for people that autoimmune hepatitis is the cause, the autoimmune disease is the cause of their hepatitis. This is called autoimmune hepatitis. As I've explained earlier, is drugs. Some certain drugs will be prescribed to you by your doctor to, reduce your immune system, or lower the immune system. In a way that your immune system will not be so active that it starts destroying your organs. Some of these drugs are corticosteroids like prednisolone. These are drugs, example of the drugs your doctor will prescribe for you. Now, let's get to prevention of hepatitis. I've already made mention of hepatitis C. This safe sex, okay? Safe sex. Vaccination, make sure you get vaccinated. Okay, there is vaccination for hepatitis A, D, and E. These three hepatitis, there is vaccination for them. However, hepatitis E vaccine is only available in China. I don't know by now if it is available in other parts of the world, but get vaccinated. Children should get vaccinated. Adults should get, but most adults that didn't get vaccinated when they were much younger didn't even know. So this vaccine lasts for 10 years. So after 10 years, you go and revaccinate yourself again. During vaccination, before vaccination, you will have to be tested first. If you're positive, and if you're not, you can now be vaccinated. Okay, and it has a duration of time that the vaccination takes place. So like this video, please don't forget to subscribe and put on your notification button. Let me know what you feel. Let me have the comments. Let me know what you feel in the comment section. Like this video so that YouTube can send it to other people, suggest it to other people to watch, because most people don't know much about hepatitis. Have a wonderful day. My name is Nurse Merit and I'm a renal nurse.